So hi everyone, in the part 2 series of the UPSC CMS paper discussion. Before starting this video, I want to thank you all for giving such a wonderful response in the part 1 series of this discussion. So I hope this part 2 also helps you out. So let's start without any further delay. In question number 1, they are saying statements regarding the radiation enteritis and proctocolitis. It is nothing but the patient who are undergoing the radiotherapy for abdominal and pelvic malignancy, they develop the radiation enteritis and proctocolitis. So what are the chronic complications of intestinal irradiation? Proctocolitis, bleeding, small bowel strictures, fistulas, adhesions. So one statement they are saying about the chronic complication, then this statement is true because small bowel stricture and fistula are there. Next, if the diarrhea happen in the acute phase, then that should be managed by codeine phosphate, diphenoxylate or loperamide in this case. Third thing is that surgery should be avoided. Why? Because the injured intestine is difficult to resect and anastomose, so there is no use of surgery in these cases. And effective treatments include sucralfate, enema and hyperbaric oxygen. So statement 1, 3 and 4 are true. Second is wrong. Why? Because they are saying surgery is the treatment of choice, and we have just now discussed that surgery should be avoided in this case. So 1, 3 and 4 are true in this case. Next question, they are talking about the gut hormones. Which gut hormone is responsible for the gallbladder contraction? So for the gallbladder contraction, cholecystokinin is responsible. So answer is C. Rest all gut hormones you can see from this table and read the action. It is all, I have taken this table from the Davidson. Now they are talking about elipid snake bite. Now elipid is one of the family for the venomous snake bite, which includes cobras, coral snake, sea snake, curate and all the Australian venomous snake. So we all know that for the snake bite, the thing preferred is immobilization, and we prefer that the victim should not move from that place. So these two statements we know that most famous evonoming, the patient should be kept still, the brittle limb immobilized with a splint and vital system supported. We should apply a pressure immobilization bandage, and the elipid we can have ptosis and difficulty swelling as a complication. So all the statements are true in this case. Next they are talking about coccidioidomycosis. Now coccidioidomycosis is a primary systemic mycosis which is caused by a dimorphic fungi, Emitis and Pusardaceae. If symptomatic, primary coccidioidomycosis presents with cough, fever, chest pain, dyspnea, while the progressive disease present with the systemic upset and features of lobar pneumonia. And coccidiosis meningitis is the most severe disease manifestation. It is fatal if untreated and require the long life suppressive therapy with antifungals like azole and amphotericin B or posaconazole. So in statement they are talking about primary systemic, this is true. These three statements are true. Fourth is wrong. Why? Because they are saying that it does not need any treatment. That's wrong. We just now read that it's a severe disease manifestation, and if it is untreated then it can be fatal. So answer for this is 1, 2 and 3. Next they are talking about fungal infection which is usually from a thorn. So sporotrichosis, which is a dimorphic fungi, is caused by dermal inoculation of fungus, usually from a thorn, occasionally from a cat scratch. So this is the appearance of the severe nodular. Answer for this is sporotrichosis. Next question, they are talking about mucormycosis. We all know in the COVID-19 era that we have the COVID-19 association with mucormycosis, and rest mucormycosis we all know it's opportunistic systemic mycosis, and all are characterized by the rapid development of severe tissue necrosis. So answer for this is mucormycosis. Next they are talking about the drug of choice for the schistosomiasis. So praziquantel is the drug of choice for all forms of schistosomiasis except Japonicum and Mekongii. Praziquantel is the drug of choice. In this case only the dose varies. Normally 20 mg per kg is given, but in case of Japonicum and Mekongii the dose is shifted from 20 to 60 mg per kg. So answer for this is praziquantel. Next they are talking about statements regarding the PR interval. So PR interval normal is 0.12 to 0.20 second, and its prolongation denotes the impaired atrioventricular nodal conduction, and a short PR interval occurs in Wall-Parkinson syndrome. So all three are true. Why first is wrong? Because atrial depolarization is denoted by P wave, not the PR interval. So answer for this is 2, 3 and 4. Next they are talking about the third heart sound on auscultation is produced in. So we can see here that the third heart sound is physiologically produced in young people and pregnancy, while pathologically in case of heart failure and mitral regurgitation. So 1, 2 and 3 are true. Why mitral stenosis is wrong? Because instead of mitral stenosis, mitral regurgitation should be there. So answer is 1, 2 and 3. Next they are talking about the physical findings in pericardial effusion. So in typical findings for the pericardial effusions are raised JVP, hypotension, pulsus paradoxus and oliguria. So all these three are true. Water hammer pulse is not seen in pericardial effusion. You are going to tell me in the comment box where you see the water hammer. Next question they are saying is about the insulin preparation. So this time they have asked about lente, but you should be knowing what other insulin preparation can give you the cloudy preparation. So isophane and lente insulin are the cloudy preparations and have to be resuspended prior to injection to ensure adequate mixing of the components. Now the more modern structurally modified long acting insulin like glargine, detamide, degludec are clear and they do not require resuspension. So these three did not require resuspension. Lente required. Other than lente we have isophane. These are cloudy preparations. Next question they are talking about polycythemia vera. Now polycythemia vera is a clonal hematopoietic stem cell disorder in which phenotypically normal red cells, granulocytes and platelets accumulate in the absence of recognizable physiological stimulus. So answer for this is polycythemia vera. Next they are talking about paroxysmal nocturnal hemoglobinuria. We all know about DAF and MERL CD55-59. So deficiency of CD59, that is MERL, has been found to be almost entirely responsible for hemolysis rather than DAF. So they were asking that primary underlying mechanism of hemolysis in PNH. So answer is CD59, which is MIRL, MERL. Now they are asking about the cast, various type of casts, and those casts are seen in which diagnosis. So let's see, they are talking about RBC cast. So RBC cast are seen in glomerulonephritis, vasculitis, malignant hypertension and thrombotic microangiopathy. So RBC cast is seen in malignant hypertension, that's true. WBC cast, so WBC casts are seen in interstitial nephritis, glomerulonephritis, pyelonephritis in the case of rejection. So in the statement they have given pyelonephritis, again that is true. Pigmented cast seen in acute tubular necrosis, tubulointerstitial nephritis and rejection, myoglobinuria, hemoglobinuria. They are saying vasculitis. No, vasculitis we see granular cast, and myoglobinuria just now we see the pigmented cast. So 3, 4 are wrong. So the following pairs, only 2 pairs are true in this statement. Next they are talking about the association of drug with calciphylaxis in chronic kidney disease. So warfarin treatment is considered a risk factor of calciphylaxis. So answer is warfarin. Next they are talking about the Mears-Stemmey test is used in which of the following clinical condition. So recurrent acute urinary symptom, Mears-Stemmey test are used. So answer is recurrent urinary tract infection in men. Now carotenoderma. So carotenoderma is the yellow coloring of the skin associated with diabetes, hypothyroid, anorexia nervosa, but most commonly it is caused by the ingestion of excessive amount of vegetables and fruit, जैसे carrot, leafy vegetables, squash. So carotenoderma and jaundice resemble each other. The only difference between them is that they can be distinguished from jaundice by the sparing of the sclera. Rest carotenoderma involve palm, sole, forehead, nasolabial fold. It only spare the sclera. So they were asking the distinguishing feature among them. So answer is sclera. Next question is regarding jaundice. So in jaundice we all know that sclera have a particular affinity for bilirubin due to high elastin content. Presence of sclera icterus indicates a serum bilirubin level of at least 3 mg per dl. If the examiner suspects scleral icterus, a second site to examine is underneath the tongue, and even green if the process is long standing. The green color is produced by oxidation of bilirubin to biliverdin. So those all 4 statements are given and those are true. So answer for this is D. Next question, they are saying that about the developmental question. So developmental question below the 70% is taken as delay, and what is the detailed evaluation? So at 34 week of gestation, they are talking about resuscitation and the child is apneic. So we prefer the positive pressure ventilation, and positive pressure ventilation if the child is preterm, that is less than 35 week, and in case we have 34 week in this case. So it is under less than 35 weeks. So we give the 21 to 30% ppv. So answer for this is positive pressure using 30% oxygen. Next they are talking about which one of the following is categorized as specific learning disability. In a specific learning disability, we have 3 things: dyslexia, dysgraphia, dyscalculia. Dyslexia means difficulty in reading, dysgraphia means spelling mistakes, and calcula means difficulty performing simple calculation. So only one thing is given among them. So dysgraphia is the answer for this. Now they are talking about vaccine associated poliomyelitis. We all know that most commonly which strain are used. So OPV3, because of OPV3 vaccine associated poliomyelitis is seen. To reduce the risk of neural tube defect in the baby, which of the following are recommended? So folic acid supplementation is recommended at a dose of 0.4 mg daily from 1 month before to 3 months after conception to prevent the neural tube defect. So first statement is true in this case. Which of the following genetic causes are commonly associated with autism spectrum disorder? So Fragile X syndrome, tuberous sclerosis, Angelman, phenyl and metabolic disorders like phenylketonuria and hypothyroidism are associated with autism. Williams syndrome is not associated. So 1, 2, 3 are true. So in this case, they are talking about a child with an acute poisoning by ingestion. So activated charcoal can be used in which of the following situation? So multiple dose activated charcoal can be used in anti-epileptic drugs like carbamazepine, dapsone, phenobarbital. It should not be used in case of common electrolytes, iron, mineral acid, alcohol, cyanide, water insoluble compound, pesticide. So in iron, corrosive, lithium, we should avoid activated charcoal. It can be used in anti-epileptic injections. So answer for this is B. Next they are saying that exchange transfusion as a method to enhance excretion of poison is indicated in. So it is indicated in methemoglobinemia and self-hemoglobinemia. Urine alkalization is a method for enhancing excretion for poisoning is aimed at achieving urine pH more than 7.5. So answer this is B. They are saying for developmental assessment of baby grasp is best assessed by offering the child. So grasp is best assessed by offering a red cube to the child. So answer for this is red cube. Type 2 necrotizing fasciitis is caused by group A streptococcus. And type 1 necrotizing fasciitis is caused by mixed infection with gram-negative bacteria and anaerobes. With regard to giardiasis, statements are asked. So giardiasis is the infection usually occurring by ingesting contaminated water, and it has a flagellar trophozoite form, and stool obtained at 2 to 3 day intervals should be examined for cyst, and duodenal or jejunal aspiration by endoscopy gives a higher diagnostic yield. So 1, 3, 4 are true. Why second is wrong? Because colonoscopy should not be there. Answer should be duodenal or jejunal aspiration by endoscopy. So 1, 3 and 4 are true. Next they are talking about cutaneous larva migrans. So cutaneous larva migrans is the most common linear lesion seen in travelers, and it is intensely pruritic, and the tract moves across the skin at a rate of 2 to 3 cm per day, and most patients with cutaneous larva migrans have recently visited a beach. So first 2, 4 are true. It is non-pruritic, that's wrong. It is pruritic. So answer is 1, 2 and 4. Next they are talking about strongyloidiasis, that is threadworm. So it is the Strongyloides turcuralis is a small nematode that parasitize the mucosa of the upper part of small intestine, and systemic strongyloides with dissemination of larva throughout the body occurs with immune suppression. 2 doses of ivermectin should be administered. alternatively we can use albendazole also. So they are saying it parasite the mucosa, that's true, and systemic is seen in immune competent. Ivermectin is not an effective treatment, that's wrong. Ivermectin is given, and lava occurrence is fast moving transient rash seen across abdomen and buttock, that's wrong. Next question, they are talking about cysticercosis. So cysticercosis most commonly, however, cerebral signs do not occur until the larva die 5 to 20 years later, that's true. It causes the personality changes, which is the most common feature, and the subcutaneous tissue should be palpated and any nodule excised for histology, and for management praziquantel is used. So all 4 statements are true for the case of cysticercosis. Next, they are talking about HAND, that is HIV associated neurocognitive disorder. So the term HIV associated neurocognitive disorder describes the spectrum of disorder: asymptomatic neurocognitive impairment, which is the most common, minor neurocognitive disorder, and HIV associated dementia. So all these 3 are true in this case. Primaquine destroys hypnocytes of Plasmodium vivax. Primaquine is used for radical cure of malaria due to Plasmodium vivax, and destruction of hypnocytes happen in the case of liver. Next, they are talking about obesity. So the production by adipocytes of adiponectin, which is an insulin sensitizing peptide, is reduced in obesity, and this may contribute to hepatic insulin resistance. So adiponectin level are reduced in obesity, that's true. If we talk about orlistat, then it is a reversible inhibitor of peptide lipase, and it is used for the treatment of obesity, that is true. If we talk about liraglutide, then liraglutide, they are saying that it can cause weight gain and not recommended in obese, that's wrong. Liraglutide is an incretin hormone which inhibits both gastric emptying and glucagon secretion, and which helps in the weight loss used in the case of obesity. And bariatric surgery is recommended when the BMI is more than 40 kg, and if the patient with comorbid condition, then the BMI considered is 35. So 3rd and 4th are wrong, only 1 and 2 are true in this case. Now they are talking about 14-year-old with chronic diarrhea and malnutrition suspected celiac disease. So in celiac disease, we do IgA anti-endomysial antibody and transglutaminase IgA anti-endomysial and anti-gliadin antibodies. So they are saying absence of TTG antibody, that's wrong. There is TTG antibody, and rest 3 statements are true. So 1, 2 and 3 are true in this case. They are talking about the most common causative agent for spontaneous bacterial peritonitis. Then E. coli is the most common causative agent for spontaneous bacterial peritonitis. The most common cause of shock in severe acute pancreatitis, then hypovolemia resulting from third space loss is the most common cause for shock in severe acute pancreatitis. Which of the following are the risk factors for acquisition of chronic hepatitis C? So IV drug, you misuse, unscreened blood products, vertical transmission, needle stick, iatrogenic parenteral transmission, and sharing toothbrush and razors. So these 3 statements are true. Fecal-oral transmission is not there in the case of hepatitis C. So answer is 2, 3 and 4. They are talking about Zollinger-Ellison syndrome, the most common non-pancreatic site. The most common non-pancreatic site in case of Zollinger-Ellison is duodenum. Which of the following is a manifestation of vascular phenomena in the modified Duke criteria? So vascular phenomena and modified Duke criteria, if I talk about, so they have given in the option general lesion. Other 3 options they have given comes under the immunologic phenomena. Which of the following statements correct regarding a normal newborn growth? So the average birth weight of neonate is about 3 kg. Now during the first few days after birth, the newborn loses extracellular fluid to about 10% of body weight and regain their birth weight by the age of 10 days. So there is a controversy among A and B option. A was giving weight loss maybe 8 to 10% in initial 2 weeks and regained by 7 to 10 days of age. So my vote is for the A option, because regained by the age of 10 days, it's not by the age of 7 days. So I'll give the vote for the A option in this case. Now they are talking about again a controversial question, that which of the following are common problem in baby with intrauterine growth restriction delivered at term gestation. So these are the major problem with IUGR, but they have divided the heading in the terms of preterm baby and just baby which are term with IUGR. So in this case they were asking the term gestation. So in babies at term gestation we see hypothermia and hypoglycemia, while hypocalcemia is seen if the baby is preterm. In preterm all hypothermia, hypoglycemia, hypocalcemia, so all three statements would have true if they have talked about preterm. In this case they have talked about term, so answer is 1 and 2 only. Now which of the following are 5 essential components of nurturing care? So these are the 5 essential components, so answer is A in this case. Alpha-1 antitrypsin deficiency, we all know it's a autosomal recessive, and clinical presentation neonatal, they prolong jaundice, in adulthood pulmonary emphysema, and rarely the skin disease paniculitis develop. So all these 3 are true, it is autosomal recessive, not dominant, so 1, 2 and 3 in this case. About the peptic ulcer prophylaxis, so stress ulcer during critical illness is a serious complication, so it is saying they are talking about the correct. So stress ulcer during clinical illness is uncommon? No, it is very common in the case of peptic ulcer. Proton pump inhibitors are effective at reducing the incidence of ulceration, that's true. In conjunction with antibiotics may increase the incidence of nosocomial infection, especially with Clostridial difficile. They were saying that decrease the risk, that's wrong, it actually increases the risk. Common practice to stop ulcer prophylaxis, one consistent absorption of enteral feed is established. They are saying that it should be continued. No, it should be stopped once the enteral feed is established. So all these 3 statements are wrong, only C is true. Now they are talking about the adverse effect of loop acting and thiazide diuretics. So hypovolemia, hyponatremia and hypokalemia are seen. Instead of acidosis they should have given alkalosis. So 2, 3 and 4 are true in this case. Anorexia nervosa they are talking about. So anorexia nervosa, this illness is often precipitated by weight loss and it arises from the food avoidance. Body image is profoundly disturbed, so that despite emaciation patients still feel overweight and are terrified of weight gain. Downy hair lanugo may develop on the back, forearm and cheeks. So statement 1, 2, 4 are true. Why 3 is wrong? Because body image is not intact, it is disturbed and patient feels weight gain, overweight and are terrified of weight gain. So 1, 2 and 4 are true. They are talking about low serum thyroglobulin level seen in. All these 4 conditions come under the causes of thyrotoxicosis. So you have to remember one, serum thyroglobulin are increased in all type of thyrotoxicosis except thyrotoxicosis factitia, which is caused by self administration of thyroid hormone. So answer for this is thyrotoxicosis factitia. Next they are talking about, they are given a situation and they are talking, is this the definitive diagnosis of diabetes mellitus? Yes, it's a definitive diagnosis. When the person has symptoms, this patient has symptoms, it has polyuria, polydipsia and polyphagia. So when a person has symptoms of diabetes, the diagnosis will be confirmed with either a fasting glucose of more than 7, that is 126 mg per dl, or a random glucose of 200 mg per dl. So it was having a random more than 200 and with a clinical symptoms of diabetes, so it's a case of diabetes mellitus. If the patient doesn't have the clinical symptoms, then 2 diagnostic tests are required to confirm. Either you should have the fasting glucose more than 126 or the HbA1c more than 48 or the random more than 200. And they are talking about that it is if the HbA1c is not provided, so diagnosis is indeterminate. HbA1c is a diagnostic of diabetes, but it should not be used to diagnose diabetes alone. For the diagnosis, you should have the fasting and the random. Now SGLT2 inhibitors. So SGLT2 is involved in the reabsorption of glucose. It is used in the type 2 diabetes and it has seen the 35% reduction in cardiovascular mortality by its use, and euglycemic diabetic ketoacidosis has been recognized as a rare complication of this class of drug. So they were asking the true statement. So this statement is true. It is used in the case of type 2, not 1. It can cause the increase in high blood pressure, that's wrong. It actually controls. And the glucose lowering effect is dependent on insulin secretion sensitivity. It is independent of insulin. So answer is D in this case. Next they are given a case and they are asking the, so you should knowing the clinical suspicion of Cushing if you have by the case of history, then you should do the case of plasma cortisol test by giving the dexamethasone. If the plasma cortisol is more than 50, in this case it was greater than 50, then you should check the plasma ACTH. If plasma ACTH is more than 50, then you will think about Cushing and ectopic ACTH production, but in this case it is less than 1.1, so it cannot be this. If it is less than 5, then you will do the CT scan, and if the finding are there in adrenal, you will think of adrenal adenoma, but in this case CT findings are unremarkable. So Cushing was cancelled, ectopic was not there, adrenal was not there. So the answer is exogenous glucocorticoid use. Why? Because the patient is the known case of rheumatoid arthritis, he must be taking glucocorticoid from the long term. So the raise in this case of cortisol is because of the exogenous glucocorticoid use. Now next they are talking about the patient underwent thyroidectomy and they are saying it developed muscle cramp, perioral, peripheral paresthesia, carpopedal spasm. These all are significant, these all are indicating towards the hypocalcemia, and hypocalcemia is managed by ionized calcium gluconate. Gonadotropin they are talking about, which is the hypogonadotropic hypogonadism. So Kalman syndrome comes under hypogonadotropic hypogonadism, while the Klinefelter is hypergonadotropic hypogonadism. Again they are talking about Klinefelter, and this they are saying that it is a tall thin adolescent boy which have gynecomastia and small testes, and testosterone level is undetectable, but FSH and LH level, again they are talking about that hypergonadotropic hypogonadism. Gonadism is not there, but gonadotropins are raised, so it is Klinefelter, which is 47XXY. Now they are talking about antidiabetic drug which may cause weight gain. So antidiabetic drug, if we talk about glimepiride, it causes weight gain, pioglitazone causes weight gain, and insulin causes weight gain. Only sitagliptin, which has no role in case of weight. So answer for this is which causes weight gain. So 1, 2 and 3 causes the weight gain, not the sitagliptin. About the listeria they are talking about. So listeria monocytogenes, the treatment drugs we can give is combination of amoxicillin, ampicillin, aminoglycoside, sulfamethoxazole, trimethoprim. Cephalosporins are not given in this case. So ceftriaxone is a cephalosporin which is not given. So 2, 3 and 4 are true. In this case they are talking about rickets. So rickets they are saying which of the following abnormality can occur in the case of rickets. So frontal bossing can be there, craniotapes or soft skull bones can be seen, hypotonia can be there. Radiologic changes are correctly seen in metaphysis, not the epiphysis. So 1, 2, 3 and 2, 4th is wrong in this case. Relative erythrocytosis. So relative erythrocytosis, that is low volume erythrocytosis seen in diuretics, smoking, obesity, alcohol and Gaze-Box syndrome. Rest all three options show the absolute erythrocytosis. So answer for this is diuretics. Now they are talking about UTI statements true. So if we talk about asymptomatic bacteria, when we say it is asymptomatic, when we have more than 10 to the power 5 organisms per ml in the urine of apparently healthy asymptomatic patient. So in general treatment is not needed for asymptomatic. Treatment is required in infants, pregnant women and those who have urinary tract abnormalities. Next is urine is an excellent culture medium for bacteria, that's true. So statement 1, 2 and 4 are true in this case. Third is wrong because they are saying that the antibiotics are recommended in all cases of asymptomatic bacteria, that's wrong. Which of the following statements are correct regarding scorpion stings? So by injecting venom from a stinger on the tip of the tail, they protect themselves from the prey. It is painful but relatively harmless scorpion sting need to distinguish from the potentially lethal So they are saying which of the following are correct. They inject stinger on the tail, that's true. Most stings are painful, that's true. Anticholinergic can be used if antivenom is unavailable, that's wrong. We have to give them antivenom. So answer for this is 1 and 2. Next they are saying about the Kissner forest disease. So Kissner forest disease, it is seen in the south of the South India, and small mammals, particularly rat and squirrels, are the main reservoir of the virus, not the monkey. Monkey are the amplifying host, while birds and bat are less important hosts. So rat, squirrel are the reservoir, monkey is the amplifying host, and the disease is transmitted by the bite of infective ticks, especially nymphal stages, and the population at risk should be immunized with killed KFD vaccine. So according to me, this question should get cancelled because none of the option given here are correct. So this question is going to be cancelled for this UPSC. Now talking about brucellosis. So brucelli behave as a facultative intracellular parasite, and if left untreated, the fever of brucellosis shows an undulating pattern that persists for weeks before the commencement of afebrile period, and the fever is associated with musculoskeletal symptoms. So all these three are true in the case of brucellosis. Now they are talking about the likely localization of thrombosis. Now ST elevation in AVR with coexistent multilead ST depression. So clinical causes for these are either left main coronary artery stenosis or proximal left anterior descending artery stenosis. So answer in this case is left main proximal left artery dist. Thickened ventricular wall with normal diastolic function. They are saying thicken. If thickening happens and there is any pathological condition, then diastolic function could not be normal. If the diastolic function are normal, only the ventricular wall is thickened, the answer is athlete's heart, because it's a physiological adaptation. Now they are talking about Carvalho's sign, which is seen in tricuspid regurgitation. The murmur is soft and best heard at lower left sternal border and may increase in intensity with inspiration, and regurgitant CV waves may be visible in jugular venous plexus. So all these history indicates towards Carvalho's sign, which is seen in tricuspid regurgitation. Next they are talking about the murmur. If we give the amyl nitrate, then amyl nitrate increase the murmur in case of aortic stenosis and hypertrophic obstructive cardiomyopathy, and decrease the murmur in mitral regurgitation and VST. So all these four options are given, and they are talking the intensity increases on inhalation of amyl nitrate. So the answer lies among the aortic stenosis and hypertrophic obstructive cardiomyopathy, and the intensity reduces on sustained hand grip, indicates the answer is HOCM. Now they are saying contraindication to vaccines. So contraindication of vaccine, you have to remember this chart, in which in one of the option they are saying that pertussis containing, that is DPT, uncontrolled epilepsy or progressive encephalopathy is developed after the first dose of vaccine, then that vaccine should be contraindicated in that case. Rest contraindication of the particular vaccines are given, so read this chart carefully. In this case they are talking about the post lumbar puncture headache. What are the features? So worse on waking but improves during the day, that's wrong. Rest and lying flat is needed in the case of post lumbar puncture headache. So 1 and 3 are true in this case. About this question, I am not sure what is going to be the answer, because I didn't get the perfect answer for this. So if you find out the perfect answer, do share me on the Telegram group or on the YouTube comment section, so I can update this question for you all later on. Next they are saying is that a full term baby born with birth weight of 2000 gram comes for a well baby visit. So they are basically talking about the nutritional supplements for infant who had the birth weight between the 1500 gram to 2500 gram. So we should give the vitamin D at a dose of 400 international unit and iron at a dose of 2 milligram per kg per day for duration of 6 to 8 weeks to 1 year. So vitamin D option are wrong because they have given 200 instead of 200. The answer should be 400, and iron 2 milligram per kg, but up to the month of 1 year of age it can be given. Next they are saying, again they are talking about the Carvalho sign. In Carvalho sign we have seen regurgitant CV waves. So V and C wave merge in this case. The volume of air remaining in the lung after normal expiration, it is nothing but the functional residual capacity. The investigation of choice for early follow-up in patient treated for anti-H. pylori drugs. So, patient who have treated for H. pylori should undergo confirmation by the repeat urea breath test. So, answer for this is urea breath test. The serological marker detectable during window period. During window period, if I talk about the serological marker detectors is IgM, NT-HbC. So, answer is IgM, NT-HbC. Uric acid nephropathy. So, uric acid nephropathy in patient receiving chemotherapy, what drugs can we give? So, we can give vigorous IV hydration and diuresis, acetazolamide, sodium bicarbonate, urate, presbyroacase. So, 2, 3 and 4 are true in this case, probenecid is not given. Varicella zoster immunoglobulin, they are saying that a pregnant lady who has been exposed to a patient of chicken pox, what things we can give? We can give the immunoglobulins and acyclovir. Varicella zoster vaccine is a live attenuated vaccine and it should not be given to the immunocompromised individual or the pregnant woman. So, answer for this is 1 and 3. Next, they are talking about in serological investigation of hepatitis B, presence of hepatitis B E antigen is an indicator of active replication of virus, we all know. Now, they are saying that simultaneous infection with hepatitis B and D followed by full recovery is associated with the appearance of low titers of anti-HBV of IgM type. So, answer for this is low titer of anti-HBV IgM type. So, we are done with the paper 1 discussion. We have discussed all the 120 question, initial 40 in the part 1 and rest 41 to 120 in this part. So, I will be coming up with the paper 2 in my further videos. So, keep studying. All the best.